While much of the world is moving beyond the pandemic, Taiwan, which for so long had kept the virus at bay, is unnerved by scenes countries have long forgotten: listless streets, shuttered shops, a run on toilet paper and untold empty seats on subways. The sudden reversal in Taiwan's status mirrors setbacks unfolding across Asia. Nations that were lauded and often envied for the way they controlled COVID-19, keeping death tolls low and allowing millions to work, attend schools and dine out, are now beset by new lockdowns, dwindling hospital beds and growing fatigue as the pandemic wears on. That feeling of defeat is most profound here. For the first time since COVID-19 emerged, Taiwan has imposed strict lockdown measures to stop a virus that's killed more than 3 million people worldwide. The self-governing island reported several hundred infections in the last week after months without any. All public spaces such as cinemas, libraries and recreation centers were ordered shut, and public schools will remain closed until at least the end of the month. These actions come as the virus and its variants flare across the region. Cases are soaring in Vietnam, Thailand, Cambodia and Laos for the first time, and returning in numbers that haven't been seen in months in Singapore, Malaysia and Japan, which is under pressure from healthcare workers and business leaders to cancel the Summer Olympics set for July in Tokyo. Largely due to skyrocketing cases in India, which has become the epicenter of the latest surge, more than 60% of the 10 million new cases recorded globally the first half of May were in Asia, according to the latest figures from the Our World in Data project at the University of Oxford. The new outbreaks of COVID-19 underscore the long road ahead for a global recovery, even as countries like the United States begin to reopen. They also point up the limitations of border controls, which have been deployed throughout Asia and relaxed in the US and Europe. It's a pandemic, said Dale Fisher, an infectious disease expert at the National University of Singapore. Eventually borders will give way. It's statistically inevitable. Social restrictions and public health measures are being tested, particularly as more infectious variants of the coronavirus emerge from major hotspots such as India. Fisher said the only way to stem the new threats, and reach herd immunity, is vaccinating populations. The endgame requires high levels of vaccination to manage what will be an endemic and possibly seasonal disease. But the vast majority of vaccines have gone to wealthier countries, including you and those in Europe. Significantly fewer doses have been delivered to poorer nations such as Vietnam, Laos and the Philippines. Leaving millions unvaccinated in dense urban centers with weak healthcare systems provides ideal conditions for variants to mutate and prolong the pandemic, experts say.